More than 13 million Australians, over half the country's population, is in lockdown this morning. We'll go to a map now showing you the areas currently in lockdown. Stay-at-home orders remain in place for all of New South Wales, which recorded its worst day of the pandemic so far yesterday. The lockdowns in Melbourne and Canberra have been extended until September the 2nd, and a nighttime curfew is back in Melbourne. And today we're adding the greater Darwin and Katherine areas to the map, where stay-at-home orders are in place for at least 72 hours. It comes after a man in his 30s tested positive after travelling to the Northern Territory from Sydney. And let's take a close look at the situation in New South Wales. Now, yesterday the state recorded its deadliest day of the outbreak. 8 deaths and 478 new cases. The yellow portion of these bars are confirmed cases in the community while they were infectious. The red portion of those bars is cases that authorities just hadn't been able to sort out by the end of the day what their isolation status was, and you can see that has grown so significantly over the last several days. And so, yeah, a couple of days ago, Kerry Champ, the Chief Health Officer of New South Wales, her tone in the media conference was markedly stronger than it's been. It's always been pretty strong, but it was markedly stronger a couple of days ago when she said she had grave concerns about the potential for this to escalate further, and we definitely saw that happening yesterday. Reporter Lara Himes joins us now from Sydney. So, Lara, concerned still that numbers could be high for some time?
Well, 478 cases recorded yesterday. That was actually the record, and with the number of deaths that were also linked to that, there were 8 of them, and among them a 15-year-old boy who was admitted for another health issue but did pass away tragically. He was COVID positive. The situation is that the signs are that the figures really don't show any signs of relenting just yet, and there are growing concerns too that we do have COVID continuing to push its way into the health system in an adverse way, especially in our hospital system. At the St George Hospital, we've seen 5 cases of COVID that were recorded linked to the oncology unit. 3 of those cases were patients, 2 of them were staff. And similarly at the Nepean Hospital, this is located in the Blue Mountains, there were 2 COVID positive cases recorded in the mental health unit. The hospital says that it is taking, or both hospitals say that they're taking all the precautions to ensure that other people, staff members, aren't affected by this. And we did hear from Dr. Kerry Champ yesterday, who was reassuring people in Sydney and also New South Wales that if you still do need medical help, those services can still be delivered to you. There's also been concern that there are COVID cases within the prison system. 4 cases recorded at Silverwater. They say that they are isolating those COVID positive patients or individuals there, and also growing concerns that COVID is continuing to impact regional communities. So particularly in the west of New South Wales, schools have also been among those targets, sadly. Out of the 9 schools that have been closed, 8 of them were in Dubbo. And we're seeing some of the statistics that children, mostly aged between 10 and 19, 40% of the cases actually fit into that age bracket, and a lot of them were Indigenous students too. There has been some welcome news though for the regions out in the west of the state. The ADF is actually making its way there today. They will be assisting with some of the vaccine rollout and also undertaking some of the logistical work required to ensure that health and safety of those residents are maintained.
And what's happening with the effort to ensure that people are sticking by the rules?
Well, police said that they were going to crack down on those who were flouting the regulations, and that they did. Yesterday, they issued 500 infringements to various individuals. 34 of those were court notices, and they also carried out nearly 4,000 compliance and welfare checks on individuals that were linked to this COVID outbreak. They said they were cracking down. They haven't stopped that. This is part of a long operation. Yesterday, they said that it is likely to go for at least 2 weeks before you could see any positive uptake from that. Overwhelmingly, most of us are doing the right thing, but some are flouting those laws. We did hear from police this morning about one extraordinary individual who just didn't seem to take seriously what police were saying.
Certainly people are moving around far too frequently at the moment, so we're certainly seeing a number of infringements for that. Perhaps if I can give you an example which will demonstrate the seriousness with which we're taking this. A gentleman at Fairfield yesterday who is COVID positive and has been issued a self-isolation order by health. Police went to his house to conduct a compliance check, and when they got there, he wasn't home. He attended sometime later and was unable to provide any excuse for being out of his premises. It's impossible to overstate the danger that person being around in the community has in terms of the spread of the virus and therefore for other community members.
So it's not just Sydney and New South Wales where the regulations are being breached. We're obviously seeing this across all of Australia, but the key message from police here in New South Wales is that they want people to reduce their mobility and, again, heed the rules.
Okay, Lara Himes reporting there from Sydney. Let's head south from New South Wales to Victoria now. And before we go to our reporter, just a graph showing you what's happening with the numbers there. So, yeah, this goes back to the previous outbreak, which got down to 0. And then, yeah, just over the last week, those numbers have been sticking stubbornly around 20 and today 24. And most concerningly, there's still a fair proportion of those infectious while in the community. Reporter Steph Ferrier joins us now from Melbourne. Steph, g'day. Yeah, so that's... those numbers just won't come down, and particularly infectious in the community still hanging around there.
Good morning, Joe. Yes, they're still hanging around the 20s, aren't they? So we've got 24 new cases today. 21 of those are linked to the outbreak, so that means they're still investigating how those remaining 3 fit into the puzzle. And unfortunately, we still have 10 of those cases that were out infectious, while in the community only 14 of them were in isolation throughout their infectious period. So we now have some 227 active cases across the state, and that's off the back of around 31,500 test results received as well. There obviously has been a little bit of an uptick as well, which is good news at least in the vaccination rate. So we were sitting at about 25,700 vaccinations that were done through the state-run hubs, and of course that's one of the 5 reasons that you're allowed to leave your home during this long lockdown.
And what are the new restrictions in place today?
Yeah, so today we're definitely seeing the effect of these tough new restrictions. I'm here obviously in Bourke Street Mall. As you can see behind me, it's virtually deserted. The shops are still all shut. And what we saw overnight was the first night of our curfew. That is going to continue for the next 14 days. And that really does bring us back to the harshest restrictions that we faced in the height of Victoria's deadly second wave last year. So effectively it means that you need to stay in your home between the hours of 9 p.m. and 5 a.m. every morning, unless you've got a work reason, an essential work reason or an emergency to be out. And once again, these things are back again. We're going to have these permitted work permits, and that's for workers that are able to go into their workplaces, because health authorities are really concerned that those workplace transmissions have ticked up, particularly among people who could have simply worked from home. We're also very sadly seeing all playgrounds closed, along with skate parks. Even the basketball rings are being taken down from outdoor basketball areas, and gym equipment is also banned as well outdoors in the parks and things like that. So that's really sad for many people who use that for their young children during this lockdown. We're also seeing the fact that we're going to have a much reduced construction capacity. So large-scale construction will go down to 25% of their workforce. Small scale will be a maximum of 6 people. And we're also going to see no masks being allowed to be taken off while you go out and get takeaway alcohol. The Premier, Daniel Andrews, said that he does not want to see further scenes of footpaths being turned into pubs, that takeaway means just that, and they need to be drunk at home. We saw some people out on the streets just congregating outside drinking areas last week, which really alarmed him, and he also reserved a lot of his anger for that engagement party with 69 people who attended that event in Melbourne southeast last week, not wearing masks, all indoors, flouting the restrictions. They're all going to face a $5,500 fine. So the Chief Commissioner here says that's a very expensive engagement party at around $350,000. But the Premier does say that, you know, these are really selfish actions, and we don't know whether or not that is going to become a super spreader event, and we don't know whether or not that has a lot of these new case numbers involved in that. We'll get some more details on that later in the day.
Yeah, okay, Stefan, just before we leave you, we obviously like to keep people across these media conferences that are held through the day, and with the growing number of spots in Australia that are affected by cases and lockdowns, we're bringing more and more of these to people live. The timing of the Victorian media conference from day to day has jumped around a bit, has it?
Yes, that's right. They did make it a little bit later yesterday because obviously they are still thrashing through the information that had been presented by health authorities in terms of this new curfew and the restrictions that we now face here. So it was a little bit later. Often it's around about in the 11 o'clock hour. If it does clash with the one that Gladys Berejiklian does in Sydney, then obviously it will be carried live on our ABC One here in Victoria.
Yep. Okay, Steph Ferry reporting there from Bourke Street in Melbourne. Greater Darwin and Katherine are in lockdown this morning in the top band. The snap 72-hour shutdown was called by the Northern Territory Government after a positive case emerged. Reporter Melissa McKay joins us now from Darwin. Melissa, g'day. So authorities don't know whether the positive case has the Delta variant or not?
Morning, Joe. No, they don't at the moment. From the Northern Territory, these things need to be sent interstate in order to figure out what sort of a strain of coronavirus it is. However, authorities are treating it as if it is the Delta strain, which is why we've gone into lockdown so quickly after just one case. We don't know a whole lot about where this virus was picked up. We do know that this 30-year-old man had travelled to Darwin after completing 14 days of hotel quarantine in Sydney after arriving from overseas. So he's flown from Sydney to Darwin via Canberra late on Thursday and then caught a taxi into Darwin CBD. He's then stayed at a hotel, visited a handful of places in the Darwin CBD before getting a hire car and driving down to Katherine where he was required for work. So that does mean now we do have a handful of close and casual contact sites in and around Darwin City and Katherine Town. We do know there are around 300 contacts. 65 of those are close contacts. We just heard from the Health Minister earlier today who said that most of those contacts have been in touch with authorities, but they are still a small number of people that do need to come forward for testing, and anyone that may have been in any of those contact sites is being urged to come forward and get tested.
Yeah, but no evidence of any transmission from him at this stage?
Not yet. We did only just hear from the Health Minister about 10 minutes ago, who did say that she's not aware of any new cases today as of yet. But of course, we are expecting an update from the Chief Minister and the Chief Health Officer later on today. And there may well be more cases detected by then. And
you had a bit of a scare there in the top end about a month ago as well, didn't you?
Yeah, we did. We were locked down for about a week, sort of end of June, beginning of July. And that was after a mine worker tested positive in Central Australia, and that was quite a big scare, and we saw quite a number of people coming through to this testing facility around that time. There were thousands of people coming forward for testing then. Now we are being told that if you're not a close contact or if you don't have symptoms, to please not come through and get tested, and we're seeing that there's far fewer people coming through the facility today, so as to not overwhelm the health staff.
Okay, Melissa McKay reporting there from Darwin. Now, there was a big jump in cases yesterday in the ACT. 3 people at TAFE campuses in Canberra have now tested positive for COVID, with dozens of new close contact exposure sites listed. The ACT's outbreak sits at 28 known active cases, with an update expected just before midday, and we'll be juggling them for you here on the ABC News channel. I know yesterday, if you're in the ACT, you could watch that live on the main channel in the ACT. I'll let you know through the morning what the arrangements are with that. Reporter Rosie King joins us now from Canberra. Rosie, g'day. So how widespread are these new exposure sites?
Morning, Joe. I think it's fair to say that many Canberrans are feeling incredibly anxious as that list of exposure sites just grows and grows. We've had more than 60 close and casual exposure sites listed overnight, and they span from the north of the ACT right down to the south. Among the close contact sites are 2 CIT campuses, and we're already aware that there are 3 confirmed COVID-19 cases connected to those campuses. There's also been a number of gyms listed, as well as takeaway venues and a lot of pubs. Among the casual sites, there is an enormous Westfield shopping centre that's been listed, as well as supermarkets, a Bunnings and a number of petrol stations. So as you mentioned, yesterday was a pretty worrying day here in the ACT. We had 19 new cases. We know 16 of those are linked, 12 remain mystery cases, and the ACT Chief Health Officer said there were 6,500 close contacts identified, but given the 60 new exposure sites listed overnight, we're certainly expecting an increase in COVID-19 numbers, but certainly a big jump in those close contacts.
And how have Canberrans been responding to this?
Well, Joe, Canberrans are known to be a very obedient bunch, and they have been throughout this pandemic, and they certainly have been since the outbreak started. Our streets are bare, people are heeding the warnings and they're staying home, and when they do leave, you can see that they're wearing masks. Of course, it has also prompted an enormous turnout as far as testing goes. Throughout the pandemic prior to the outbreak, we're usually averaging around 1,000 tests a day, but in the last few days we've seen that ramp up to between 5,000 and 6,000 tests every day. That's of course putting pressure on the testing sites. The ACT government has been very clear in saying that they are doing the very best that they can. They are increasing capacity at the sites that they already have, and they're racing to open pop-up clinics and open up new centres as quickly as they can. But yes, 19 new cases yesterday. The lockdown's been extended for 2 weeks, so I would say we're all bracing for some bad news.
Okay, Rosie King reporting there, one of those obedient bunch of Canberrans. As other states and territories battle COVID outbreaks, Queensland is clamping down with the toughest border restrictions since the pandemic began. From Friday, essential workers from New South Wales will need to have had at least 1 dose of a COVID vaccination to enter Queensland. No new cases were recorded yesterday, but Premier Anastasia Palaszczuk says she's worried about the Delta outbreaks in other states and territories. A record number of bookings for COVID vaccinations in South Australia has been set after 16 to 39-year-olds were given access. Charles Bryce reports from Adelaide.
Yesterday we saw booking numbers never previously seen before here in South Australia, with almost 116,000 appointments being made to get vaccinated. This all occurred after the state government announced last week that anyone aged between 16 and 39 would be eligible for either the Pfizer or AstraZeneca vaccine from yesterday. The bookings officially opened from 9 a.m. yesterday, and within 3 hours there was already 97 appointments secured. That is a significant increase on the previous record of vaccinations made in one day. That did sit at 29,000 in early June. The huge influx of visitors to the booking site actually made the website crash, so that did cause a bit of confusion and did also cause delays for people trying to book, but it was restored later. These bookings will be for throughout the months of September and October, and that's when South Australia will see an increase of vaccination supply. We are currently receiving about 65,000 doses per week. That will go up to about 142,000 doses. And of the 1 million Pfizer doses that Australia received from Poland, South Australia has secured about 50,000. So there is plenty of vaccines to go around, but they are getting snapped up pretty quick.